Okay, here we are. We'll get started. Hi, everyone. I'm Alex Wesley. I'm the Director of Marketing for USTA New England, and I would like to introduce Dr. Mark Kowalski. He is a board-certified orthopedic surgeon with subspecialties in sports medicine at Orthopedic and Neurosurgery Specialists, ONS for short. ONS is an exclusive orthopedics partner of USTA New England and has locations in Greenwich, Stamford, Wilton, and Danbury, Connecticut, as well as Harrison, New York. Dr. Kowalski completed 2 subspecialty fellowships, the first in sports medicine at the Lenox Hill Hospital, Nicholas Institute of Sports Medicine and Athletic Trauma, and the second in shoulder and elbow injury from the Washington University School of Medicine. His expertise spans both surgical and non-surgical management of sports injuries to the shoulder, elbow, and knee, and he takes particular interest in the management of arthritis, instability, ligament injuries, and disorders. With a history of caring for athletes at all levels of competition, he's here today to discuss injury prevention strategies for peak performance, especially as we head into these cooler New England weather months. We're excited to have you here today, Dr. Kowalski. I'll pass it over to you.
Thank you so much for that introduction and for allowing me to take an hour of lunch from everybody's busy schedules to discuss some of these important topics. We at ONS really enjoy collaborating with organizations that prioritize player welfare and athlete welfare in general. So the partnership with USTA New England has been a great one. So thank you for all of your effort in putting this together. I also want to give a shout out to Shannon and Kimberly on our end for spending a ton of time also working with USTA New England on making this work. And hopefully it's one of many talks that we can provide to your athletes to keep you safe and keep you on the court. So a lot of what I want to talk about are topics that we also discuss with our youngest athletes. We also see about 4,000 kids a year, at least in our group, and take care of a ton of local high schools and colleges. And some of the topics are consistent between the two groups, the competitive recreational older athlete and the youngest student athlete. Both need to consider some of these topics in order to stay injury-free, stay ahead of the game, and then effectively treat injuries when they occur. I'll try to customize the talk, to tailor the talk to our community to make it as relevant as possible. But please feel free to ask questions. I think it makes it much more impactful and interesting. So I know that our crew is monitoring questions as we go. And I'm happy to either be interrupted or to tackle some of them at the end of the talk. So, the racket sport athlete spans a number of different activities, and I don't really want to make this talk exclusive only to racket sports, although of course with the USTA that's the focus. There are going to be other recreational athletes who play adult softball or baseball, who swim either just for fitness or as part of triathlon preparation and competition. Some people play men's lacrosse, for example, or adult volleyball leagues. And all of these athletes have similar patterns of injury that can occur and similar strategies that they can employ to prevent these injuries. But in the realm of racket sports, obviously we're here to talk about tennis, but there are a variety of other racket sports that are relevant, and I think you'd be surprised at how popular they are. So these span from tennis to squash. You might be surprised to learn that badminton is the most popular sport globally in the racket sport category. Tennis is a distant second. And then, of course, pickleball is exploding in popularity. And then there's padel, which is far more popular in European and Middle Eastern countries. And then, of course, squash. So growth in tennis, though, which has obviously been around for eons, has been significant. So more than 24 million people played the sport as of 2022. There's usually an increase of about 1 million participants per year, although pickleball's sort of chipping away a little bit at that. And the participation has grown by 6 million since 2020. What's interesting about tennis, and maybe other racket sports to a lesser degree, is it can be a life-saving and life-preserving health intervention, actually. Those who either participate or compete consistently in tennis live an additional 9 to 10 years versus those people who are sedentary. And participation in racket sports reduces risk of overall cause mortality by 47% and overall cardiovascular death by 56%. So kudos to our community for choosing a sport that can actually preserve and extend quality of life. Now, as I said, pickleball is chipping a little bit at the numbers of growth in tennis. There's obviously millions of people, 36 million as of 2023, who participate in pickleball. And although we think of it as a sport that has a low threshold to entry for our older athletes, the fastest growing cohort in pickleball is 18 to 34 years old. And I just spoke with a mentor of mine at the American Shoulder and Elbow Surgeons meeting, the current chairman of Columbia, who was an avid tennis and squash player, who has completely pivoted to pickleball. And most of the people he competes with are young athletes in their 20s and 30s. Now, there are a large spectrum of common injuries that we encounter when we treat racket sport athletes. These can generally be categorized as either traumatic injuries or overuse. The traumatic injuries are the sprains and strains, the tears of the structures that are important for joint stability and function. So muscle strain, as in calf strains, which are incredibly common. Tendon rupture, either Achilles in the lower leg or the rotator cuff in the shoulder. Ligament sprains, and typically at the ankle level. Meniscal tears of the knee are quite common, and then fractures of any type, but particularly at the wrist if you fall on an outstretched arm. And then the overuse injuries are equally broad. Obviously, bursitis of the shoulder, epicondylitis in the form of tennis or golfer's elbow, tendonitis of any joint, plantar fasciitis of the foot, and then back pain. Some of these injuries are going to be uniquely common in certain populations. So sprains and strains are about 3 to 4 times as common in men than women, and fractures, primarily due to osteopenia and osteoporosis risk, are 3 to 4 times more common in women than in men. We're going to talk about some general risk factors and preventive strategies to address all of these different injuries, and then at the end of the talk, time permitting, we can dive deeper into the specific injuries that we encounter and how we treat them. And then depending on your questions, we can go deeper into the weeds. But the risk factors can be generally categorized into those risk factors that depend on equipment and those risk factors that depend on overall bone and joint health and preparation. So equipment risks have to do primarily to your racket strings and racket grip, and we'll talk a little bit about those. And then the preparation is really where we're going to spend the most time. So the variety of ways of measuring the appropriate racket grip, there's generally 3 techniques. Either you can take an objective measurement of the first flexion crease of the palmar crease to the tip of your ring finger to determine the appropriate grip size. Or you can just ballpark it based on your height. So if you're less than 5'3", a 4-inch circumference is more or less appropriate. If you're taller than 5'8", then a 4.5-inch grip is more or less appropriate. But obviously players at your level are going to want to meet with your tennis professional or your sporting goods store and actually have them measure you and then put you in the precise grip for your hand. Either grip extreme is detrimental. So if you have a grip that's too large for your hand, you're going to have to grip tighter in order to maintain control of the racket, and you are more prone to develop tendonitis of the elbow, tennis or golfer's elbow, for example. If the grip is too small, you can run into trouble. Primarily, you'll run into wrist trouble, but can also develop the same tendonitis. So you really want to make sure to tailor your grip size. And I think a discussion of racket stringing is a little bit beyond the scope of this talk. Obviously, racket stringing has become a science unto itself, choosing the appropriate strings and making sure they're tensioned to the appropriate degree for your style of play and preferred stroke and your grip can help to mitigate the risk of force exerted on the wrist and elbow and subsequent injury. So now we're going to talk a little bit about strength and conditioning in general. And this was Dr. James Fries, the former professor of medicine at Stanford, who said if you had to pick one single thing that came close to the fountain of youth, then it would have to be exercise. Obviously, you all have already recognized that, as we've talked about. You're participating in a sport that uniquely impacts health, duration of life, and quality of life years. But in addition to the playing of the tennis, a formal strength and conditioning program off the court is incredibly important to make sure you stay injury-free. So I want to talk a little bit about what a quality strength and conditioning program should look like. So when you're in that gym, when you're performing strength and resistance exercises, you want to perform about 10 to 15 reps, particularly for our older athletes, to start. And if you're focusing more on endurance and less on building power and bulk, Then you can lighten the weight and increase reps to 15 to 20 at a time. In terms of the amount of time you spend in the gym and the frequency of sessions, you want to spend a minimum of 30 minutes on at least two non-consecutive days per week. You want to give yourself enough time to recover in between sessions. When you're performing a specific exercise, we've already talked about how many reps to perform, but when you're performing a given rep, you want to use proper form. Some of us, particularly less experienced or our youngest athletes, tend to perform exercises with improper technique, and that's one of the most common reasons to get injured in the gym. When you're performing a certain lift, you want to lift for 3 seconds, hold for 1 second, and then return the weight over a period of 3 seconds. And this will make sure you get the most out of the workout, and also you maintain control and avoid injury. Exhale with exertion, don't hold your breath, and use smooth, steady movements when you're performing exercise. So here are some guidelines from the American Heart Association, because it's not all about just going in the gym and lifting weights. You want a balance of high intensity activity and some cardiovascular. So here's how the American Heart Association broke it up. So you want at least 30 minutes of moderate intensity for about 150 minutes or per week, or 25 minutes of vigorous activity for 75 minutes. And you want to incorporate some high intensity. You want moderate high intensity muscle strengthening twice a week. So when you go into the gym, you want a little bit of a hybrid is what this slide is saying. You want a little bit of cardiovascular and a little bit of strength training in order to get a well-balanced workout. Well, this previous slide, if you notice, distinguishes between moderate intensity and vigorous intensity cardiovascular exercise. Now, tennis in and of itself certainly qualifies for vigorous intensity workouts, as you can see in this stratification. So lighter intensity for our less experienced or more sedentary athletes is basically just a light, slow walk. Moderate intensity is going to be things like more of a brisk walk, a jog, a very slow jog, or a gentle bicycling. And then our vigorous activities are going to be a faster jog or run, a game of tennis, for example, are all going to be in the vigorous intensity category. So if you're a consistent participant in USTA New England activities, you're probably already satisfying the first chunk, the cardiovascular chunk, and now you would just need to pepper in some of the strength and conditioning. One of the most common questions we get asked is, what is the role of stretching in my strength and conditioning program and in my preparation for tennis? There's been obviously a lot of controversial articles in the lay media about whether stretching is even helpful, whether it should be a part of our program. And the short answer is yes, stretching is still essential. Now, what I try to tell patients is, you are who you are. There are going to be some patients who have what we call generalized ligamentous laxity, who are so-called double jointed or super flexible, and they've been that way for life, and it may even run in their family. And there are other people that are just super tight and inflexible, and that's just how they're built. We're not trying to create flexibility where it doesn't exist. All that we're trying to do with a stretching program is to bring you to the most flexible end of your range, to maximize flexibility according to what's possible for you, and a consistent stretching program will help you to do that. However, what's also important to understand about stretching is it's not meant to be done right before you play. If you watch football, for example, and you're used to going to Jets or Giants games, you may see that it's not really a thing anymore for the 53-man roster to line up in 5 rows of 10 and spend a half hour stretching. What they do instead is dynamic warm-up, which we will talk about. There's some science that indicates that stretching right before you play can actually create a little bit of relative muscle weakness, which might increase your risk of injury somewhat. So while we do want to stretch, we don't want to stretch right before we play. We want to stretch as a part of our strength and conditioning program in the gym. We want to stretch as a part of our habits, rituals, and routines, perhaps at night at home or in our home gym, or a part of meditation and mindfulness. But we really don't want to stretch right before we play. Having said all that, when it's time to stretch, here are some tips. Just like we provided tips for strengthening, here are some tips for strengthening. So we talked about when to do it, not before games, but instead as a part of our strength and conditioning program. When you're performing a specific stretch, you want to hold it for 15 to 30 seconds to make sure you're getting enough out of the exercise. Deep breathing, just like strengthening, we never want to hold our breath. For those scuba divers out there, you know, one of the dogmas is never hold your breath, never stop breathing. And the same thing is true for a strengthening, stretching, and conditioning program. Don't bounce because that can increase the risk of injury. Stop if it hurts because pain is not a part of making progress with flexibility. And we talked about avoiding stretching right before you play. So what do we do before we play if not stretch? Well, we want to do what's called a dynamic warm-up. Dynamic warm-up accomplishes everything we thought we were doing with stretching in previous generations, but actually gets the job done. We want to improve our heart rate. We want to improve blood flow to the muscles that are going to be working hard over the course of a match. And we do want to maximize flexibility, but engaging our muscles helps us to do that. If we've stretched off the court, then doing a dynamic workup on the court will prime those muscles to be as flexible as they need to be. So we want to do this right before we play. We want an adequate dynamic warm-up to last at least 10 or 15 minutes, and we want to simulate sports activities. So we know from watching tennis matches, and our more experienced participants in the USTA New England will also know that what do tennis players do before they play? Well, they play. They just play with much less intensity. They hit with their opponent. They do some ground strokes, volleys, and then they practice serves. They do all the components of the match that they're about to execute, but they just do it to a lesser intensity to engage the muscles that are going to be performing during the course of the match. But here's an example of some of the more typical dynamic warm-ups that we might perform as a part of really any sport, but tennis included. So you can see the first column is just a simple light jog around the court, for example. Static high knee tucks, where you're simply walking from one end of the court to the other while bringing your knee up to chest level. Obviously, butt kicks and power skips we know about. The lunge and twist is a good one, where we go into a lunge and then twist when we get to the lowest position, bring ourselves back up and do it again on the other side. The carioca, which is a side-to-side shuffling movement. Lateral lunge and twist, similar to number 5. Simple slides, which is a slow walk across the court sideways. High knees with crossover. And a slow, exaggerated back pedal. All of these things are good dynamic warm-ups to perform on the court before you play, in addition to volleys, ground strokes, and serves. So I want to take a moment now and pause. I've put together a couple programs that can be helpful. I think the first one is a stretching program head to toe that you can review and incorporate into your own protocol that you have now. It's fairly extensive, so you may want to pick and choose certain exercises that you're either familiar with or are interesting to you. But what you can do is scan this QR code, and it'll link to a program called MedBridge. MedBridge is a physical therapy program that our therapists use to create home programs for our patients, and I've used this also to create my own home programs for our athletes. So take a look at this stretching program. I provided a couple of examples here. So child's pose is a yoga position that most people are familiar with, that is head to toe body stretch. Downward dog also incorporates stretching of the shoulders while also a little bit of core strength. And then the pigeon pose, these are all yoga poses, is a great stretch for the hip flexors and the gluteal muscles. So there are others in this program that extend beyond yoga positions that target specifically upper body and shoulder and lower body, hip, knee, ankle. So this is a similar program, but more on the strengthening side. And I think what our athletes can realize is that you really don't need a fancy gym, and you don't need a ton of equipment to perform a strengthening program adequate for endurance sports. And I put tennis in that category. Of course, strength is important and power is important, but you can actually get a lot done without a single barbell or dumbbell. Body weight bands, rubber bands that our therapists provide that you can get online, and at the most a 2 or 5 pound weight. With that simple equipment that you can have at home, coupled with this home program, you can put together a fairly comprehensive strengthening program. So scan that QR code and then review it at your convenience and see which exercises you can incorporate into your program. It's a lot, probably too much to do at one time. So if you have enough time for a 5-day-a-week strengthening program, you can split it up, let's say, into 2 upper body days and 2 lower body days with 3 days off to do other stuff, and also to allow yourself adequate recovery in between. So we've talked about what you can do off the court and before you play. I just wanted to include this one slide to consider what you should do afterwards to take care of your body. So I was, one of the reasons we had to delay this talk is I spent 2 weeks in Japan in October, traveling with the US rugby national team. And they travel with their own strength and conditioning staff and coaching. And their head of strength and conditioning put together this simple 100-point scale to give his athletes, these are 20 to 30-year-old young men, guidance on how to structure a post-training or post-game recovery program, because that's equally important. After a tough match, your body will be broken down. In fact, what you do when you work out and when you play is you break down muscle tissue. You build up lactic acid, and that muscle needs to rebuild in order to be ready for the next training session and for the next match. So structuring a recovery day or the day after you play or after a strenuous training program is important. So you may not need to do this exact program, but it's just a visual of what activities are helpful. So for these young men, the strength and conditioning coach wanted them to choose high yield and less high yield activities to create a total of 100 points. So 30-point activities include adequate sleep, so at least 8 hours for most of us if we can achieve it. And then some sort of mental decompression, quality time with friends and family, and a professional massage if you have access. So we traveled with a massage therapist, but many of our audience members may already go for massage as part of their maintenance, and incorporating that into your recovery is important. Other things that can be helpful for 20 points each include cold water immersion, and we can talk a little bit about that, a session in the pool for just some gentle swimming, flexibility. So we talked about stretching. There are other things that are maybe less intuitive, mindfulness and meditation, deep breathing or breath work. Some of our audience may be familiar with the importance of breath work, compression therapy if your gym has access to it. All these things can be helpful in order to take care of your body and help your body recover for the next go round on the court. So I wanted to take a break from that part of the discussion and now pivot only slightly to a discussion of the other things we can do off the court to make sure we can perform at our best and avoid injury. And these have to do with fueling, hydration, and nutrition. So the themes that I repeat with my youngest athletes to make sure they're doing this properly is to develop habits and routines. Figure out what works best for you in terms of pre-match meals, for example, and strategies for hydration during matches, and repeat those time and time again, each and every match, each and every tournament. You don't want to introduce new foods and new routines because they may not work and they may actually be counterproductive. Hydrate frequently throughout the day, throughout the week, and especially when it's time for a tournament. And never skip meals, including breakfast, and plan your day with respect to meals and hydration. Finally, be thoughtful about the ingredients you consume, turn the package and bottle around, read the label, and make sure that you're accomplishing the goals you set out for yourself. So just a very quick look at what appropriate hydration looks like for an athlete. So before a match, 1 to 2 hours before, 2 to 3 cups of water. 15 to 30 minutes beforehand, 1 or 2 additional cups. For every 15 to 20 minutes of match play, another half a cup or cup. And you really only need to consider something like a Gatorade or Powerade if you participated in a match or training session for at least 60 minutes. Less than an hour of playing, there really is no role for a sports drink. And then post-exercise, 2 cups of water for every pound lost. And I'm happy to go into detail about how we measure that. Now, we get a lot of questions about products with regard to hydration and nutrition. So here's the first one. Are sports drinks a good idea? So I've already answered this to a certain degree. Sports drinks like Powerade, Gatorade, and others are really only important if you've played for at least 60 minutes, but they can be effective. They replace sweat nutrients and electrolytes, and they replenish carbohydrates, and we'll talk about the importance of those. But you want to turn that bottle around and look at the label, because many of these sports drinks are basically just loaded up with sugar, too much sugar, in fact. So you want to make sure there's no more than 6 to 8% carbohydrates in your given product. And to be honest, when we travel with the rugby team, we dilute our Gatorade by half and still accomplish our goals. One of the other questions I get asked, which isn't on the slide, is what about electrolyte replacement or electrolyte supplement? And I do a lot of running myself, and I actually use electrolyte replacements rather than something like a Gatorade or Powerade, but they're both doing the same thing. You can argue that the electrolyte replacement powders or pre-made drinks have less sugar and more of the nutrients and electrolytes that you'll need, so they're perhaps more efficient. That's why I choose to use them, and there are many products out there. The one I use is called Tailwinds, which is made for runners, but is perfectly appropriate for also for tennis players. The GU products, GU, which we call Goos and Chews, the more chewable variety, can be used together with water and give you the same electrolytes and carbohydrates that you need. And I'm sure questions will come up later, and I'm happy to answer them. So in terms of fueling, in terms of the nutrition piece of it, this is what a well-balanced diet of an athlete should look like. We no longer use a food pyramid. We use this pie chart. And most of our calories should come from carbohydrates. About a quarter of our calories to a third should come from protein, and then the rest should come from fat. So why are carbohydrates so important? They provide to us the glycogen. And the glycogen is essentially the gasoline in the tank. It serves as our fuel source. So if we take the average 70 kilogram, about 150 pound athlete, for a high intensity sport like tennis, we should be getting about 350 grams of carbohydrates per day in order to provide the glycogen that we need to perform. And just as a reference point, and a cup of pasta, and I think a lot of us forget how small a cup is, but for those of us who cook a lot, a cup of pasta only has about 40 grams. So you would need many cups of pasta in order to get that 350 grams, and you want to diversify your diet somewhat, but just as a reference point. Protein is equally important. Protein is used to provide amino acids, and just like glycogen is our fuel source, you could think of the amino acids as the cinder blocks. It helps us to provide building blocks to rebuild muscle that has broken down over the course of a training session or match. So, I've listed here for strength athletes, but for more endurance athletes, the amount is not too dissimilar. It's up to 1.5 grams per kilogram. So for that same 150 pound athlete, we need about 100 grams of protein over the course of a day. Now, we obviously think of protein as coming primarily from meat, fish, chicken, etc. And they certainly each do have somewhere between 20 and 30 grams of protein, but we need 100 grams, and we're not eating steak for dinner, for breakfast, that is. So we want to diversify our protein sources throughout the day with breakfast, lunch, and dinner. And we can get protein from yogurts and cottage cheeses. We can get proteins from beans, lentils, and quinoa. And of course, from peanut butter, which is a great snack food for athletes. So we can get our protein from a variety of sources. Well, just like the energy drink question, just like the Gatorade and Powerade question, many people will ask if protein shakes are helpful or necessary. Protein shakes are helpful for a lot of athletes. They help to efficiently consume amino acids to provide protein for rebuilding muscle. If we're going to use protein shakes, though, if we're using it sort of for our athletic goals, we want to use it during what we call the anabolic window. We want to use it during the first few hours we come off the court or the first few hours we leave the gym. During that anabolic window is the most helpful time that our body can take those amino acids and rebuild muscle. And what kind of protein shake is also important. So whey protein is going to be the best type. There are a variety of proteins that are out there. And whey is readily available, easily digested, and provides leucine in addition to the other amino acids. When you purchase protein powder for a protein shake, you want to, again, turn the package around, look at the label, and you want to try a clean product. What happens is a lot of these commercially available products will load up with ingredients to make it tasty, and that means a lot of sugar that's unhelpful. They also can load up with ingredients that some of our hardcore gym rats use and some of our rugby and football players use in order to really build muscle bulk and power in the gym, like creatine, which a lot of our USTA athletes may not need. And it has some caffeine in it too. So you really want to try to choose a clean, pure whey protein powder if you're going to be using protein shakes. If you're using a protein shake as a meal replacement during the day because of your busy schedule, that's a little bit of a different discussion, because then you do want it to have a certain amount of carbohydrates, and it's probably okay for it to be more of a mixed product to accomplish your nutrition goals. But in terms of working out, you want a clean whey protein shake to be used right after you work out. And then finally, the fats. Now, I have to usually focus on this one with our youngest high school athletes, but for those adults in the room, I think we all know that we need to stay away from processed foods and saturated fats to the extent possible. We do need about a third of our calories from fat, but we want it to be from plant oils, soft margarines, nuts and seeds, avocado and hummus, that's where we're really going to get our best fats, and we do need some of that in our diet. So as important as what we eat is when we eat it. So we talked about planning our meals throughout the day. We want to make sure that we preserve breakfast no matter how busy we are. This is a time when a meal replacement is not necessarily a bad thing. If it's a choice between skipping breakfast or a meal replacement, I'd much rather you do something in the morning. It executes the first step of a healthy daily meal plan, and it avoids muscle breakdown. If you don't give your body calories when you first wake up in the morning, your body's going to look for it elsewhere, and it's going to start to break down tissue in order to do that. And it doesn't discriminate which tissue to break down. Some of your muscle will suffer. So you want to make sure to incorporate a healthy, well-balanced breakfast if you can as a part of your plan. Now, we talked about how to strategize hydration. In terms of strategizing caloric intake, you want to have a meal 1 to 2 hours before you play. You want this meal to be small, 200 to 500 calories. You want it to be loaded with easily digestible carbs for that glycogen fuel, and you want it to be low in fat and low in fiber in order to avoid unnecessary ingredients and avoid GI upset. And again, familiar foods, create habits and rituals that you're familiar with and execute those habits each and every tournament. Now, after competition, there should be a couple different meals. There should be a snack right after you play within 30 minutes, and then a real meal about an hour or two later. So that 30-minute meal is going to give you a small snack like some orange slices, banana, and peanut butter, or nutrition bars. You want to replace the glycogen, particularly if you're playing multiple matches in a tournament per day. And you want a little bit of protein to rebuild muscle that you've broken down. You want it to be nutrient dense. Now, after competition and a couple hours later, you want to have your more substantial meal. So the yogurt, banana, and sports bars are more of that quick snack. And, a breakfast cereal, a well-appointed salad, a well-appointed sandwich. These are examples of a good post-game meal a couple hours later. Now, another question people ask, in addition to protein shakes and sports drinks, is energy bars. What are the role of energy bars in a well-executed meal plan? It can be a meal replacement, although that's not ideal. It can be that small snack that you need right before you play or right after you play. But you want to, again, turn the package around, read the label. Most energy bars on the market, most nutrition bars on the market are basically candy bars, just rebranded. So the Clif bars are a good example. I used to think Clif bars were great. In fact, when I was a fellow many years ago, helping out with the Jets with my teachers, they used to have like piles and piles of Clif bars for their athletes. Now, professional football players can get away with it, but if you look at the ingredients, it has 42 grams of total carbs. I mean, that's wild. So when you look at the label of your nutrition bar, you want to make sure that it has no more than 10 to 12 grams of sugar and at least 5 to 10 grams of protein. And typically, the good nutrition bars are loaded up with seeds, nuts, nut butters, whole grains, dried fruit. Kind bars are a great example. I mean, Kind bars obviously have diversified their offerings now, so they can, capture market share. But their original Kind bars are a great example of a wonderful nutrition bar to be used for athletes. So this is kind of my 4-point plan for athletes to stay on the court to review. So we've talked about the equipment, which, a little bit beyond the scope of the talk, but you want to make sure your grip size is appropriately sized, and you want to make sure your strings are, you want to make sure your rackets are restrung on a regular basis. I think no more seldom than once a year, and consult closely with your tennis pros to make sure you're choosing the appropriate string and the appropriate tension. You want to pay careful attention to what we've talked about with respect to preparation. So strengthening, conditioning, and stretching off the court, a well executed and thoughtful hydration and nutrition plan. And then there's the pace and healing. So you want to make sure to moderate each session. Don't exert yourself excessively during training to the point where you leave yourself vulnerable to injury. Make sure that you incorporate adequate rest between training sessions and after matches, and then execute an appropriate recovery plan as to what we talked about. And if you do happen to get injured, then you really do need to strongly consider rest in order to recover, seeing a health professional, either a physical therapist or a physician like myself, to identify the injury, diagnose, and develop an appropriate treatment plan. We have a little bit of time remaining, so I'm going to dive a little bit into specific injuries, and keep track of your questions, because I want to make sure to answer as many questions as you have as well. And I'm not going anywhere. I'll stay as long as needed to answer the questions that we encounter. So muscle strain, tendon rupture, I put them in the same category because the mechanism and principles are the same. Let's take the calf muscles and the Achilles. They're actually continuous structures. The three calf muscles, the gastrocnemius, the two gastrocnemius heads and the soleus underneath, they all fuse to form the Achilles tendon, which attaches to your calcaneus heel bone and helps you plantar flex or point your toes downwards, which is important for stepping off when running and for jumping. But when you exert what we call an eccentric force on any muscle tendon unit, where the muscle is squeezing in order to generate force, but the cord is exerting a stretch on that same tendon, that opposing contraction or squeezing and stretch, extending, creates an injury. And that can either be a strain of the muscle or a rupture of the tendon. Now, strain of muscle is no big deal in the sense that they all heal on their own. Even grade 3s, frankly, will heal where the large portion of muscle separates. We manage grade 1, 2, 3 strains all the same, which is non-surgical management, a period of rest, icing, compression, anti-inflammatory medication, and then I do often recommend physical therapy to accelerate recovery and prevent recurrence. I think the distinction, though, is when instead you sustain a rupture, where in this case the Achilles tendon pulls off the bone or pulls apart. Those don't always heal. Now, there's a bit of controversy here. There are certain tendon ruptures that will heal, and then there are certain ones that don't. So consulting with your physician and understanding how to distinguish between the two is important. But when tendon ruptures occur and there's a concern about the tendon healing with the appropriate tension and giving you back the function that you need to return to the court, surgical intervention is often required. Ankle sprains are a little bit different. Sprains, whether it's the ankle or any other joint, refer to tears of ligaments. So in the previous slide, we talked about the muscle tendon unit. So tendons connect muscle to bone, ligaments connect bone to bone. And in the case of a sprain, for example, the ankle, when the ankle twists and the strength of the ligament is overcome, the ligament tears. So when you sustain an ankle sprain, quote unquote, you have sustained a tear of the ligaments that stabilize the ankle. How we grade these sprains depends on how many ligaments have torn. If it's a single ligament, the ATFL, that has torn, that's usually a grade 1, and that's going to heal a bit quicker. If it starts to include the CFL, the ligament in the back, or the ligament on the inside called the medial deltoid ligament, those can be grade 3s, and those take much longer to heal. As a rule, whether we're talking about muscle strain or ligament ankle sprain, grade 1s can take at least a couple weeks to get better. Grade 2s can take minimum between 4 to 6 weeks to get better. And grade 3s can take 6 weeks plus to get better. And obviously we individualize recovery to the specific patient. But what we try to coach our tennis players on is don't go back too soon. Even though I know you're eager to get back on the court, and these injuries often occur at the worst time when a championship tournament is right around the corner. If you go back too soon, that's when the risk of recurrence goes up, and then it becomes a more chronic recurring problem. So allowing adequate recovery time is super important. The meniscus is in the knee. The meniscus is even distinct from muscles and tendons that we talked about with strain and rupture. It's even different than tears of ligaments, which is a sprain. Meniscal tissue is cartilage. It's a circular wedge-shaped cartilage structure that sits in between the two bones of the knee, and it serves as a shock absorber. As the knee moves and bounces one bone against the other, the wedge-shaped meniscus in between the bones can provide some shock absorption. Because the blood flow to the meniscus is pretty terrible, and because it is subjected to so much force in the course of sports, that's why meniscal tears are so common. The good news is that I try to tell patients, abandon any intuitive notion you might have had about the meniscus. What we need to understand about the meniscus is they often tear even without trauma. In other words, most tears occur because of wear and tear. Even when they tear, they're not always painful. And even if they are torn and painful, we can actually alleviate the pain with conservative treatment to the extent that your knee is no longer painful. And you can go live a great life with a meniscal tear and return to your team and return to the court and hopefully never need treatment of this meniscus ever again. So I want to reassure most patients that most minor meniscal tears, particularly ones that happen because of wear and tear as opposed to the traumatic variety. These don't need surgery. They will get better and they rarely need additional care. The ones that need surgery are the ones that do happen to continue to create pain despite conservative treatment. The ones that perhaps have a piece that's flipped out of position, either creating pain or creating a blockage to the knee, or the ones that are associated with a more significant injury like an ACL. Those are the ones where surgery is sometimes required. But more typically, we treat these patients with anti-inflammatory medication, some physical therapy, and sometimes an injection of cortisone or other medication, and we can get them back out onto the court. So now on to the upper extremity, and I think I'll leave it here after the discussion of the rotator cuff, and then we'll open it up for some questions. But the rotator cuff are obviously a very important group of muscles, 4 muscles that originate on the shoulder blade. All 4 muscles then make their way out to the joint. They cross the ball and socket joint of the shoulder. They then fuse to form a single rotator cuff that attaches to the humerus. And these rotator cuff muscles are important for 2 reasons. 1, they help us rotate the arm in space. And 2, the rotator cuff helps us to maintain stability of our joint. And they serve both roles equally importantly. So when rotator cuff tendons tear, they can be a problem. But some of the same themes of the meniscus are true for the rotator cuff. In other words, you don't always need trauma to tear them. When they tear, they're not always painful. But when they're torn and painful, they don't necessarily need surgery. And with appropriate conservative management, many people will get better and may never need additional care. So why don't I stop there? It's about almost 12:45. I'm going to open it up for some questions, and we can always dive deeper into some other topics depending on what ground we cover with questions.
Thank you, Dr. Kowalski. This has been amazing and full of so much useful information for everyone. We actually have the questions at this time turned off, but I have questions that people wrote in beforehand that I'd like to ask you if you'll,
Sure.
if you'll answer those.
Absolutely.
So, we know as we're going into the cold months, somebody wrote in, what is the lowest temperature that's safe to play a match outside?
It's a good question. So in full disclosure, I'm a Floridian. So for the first 18 years of my life, I was a kid in Florida playing sports year round in, coldest 70-degree weather and warmest 100 degrees. And I'm still really a Floridian at heart. So I've lived here longer than I've lived in Florida, but the cold is still difficult for me. But I've learned a lot about winter sports in the Northeast, and paddle sports and racket sports are commonly played outdoors by our patients in Connecticut and New York. So it's important for us to help you to do that. So the truth is, as a runner, however, I have trained as a runner in the coldest of temperatures. And I don't think there's a specific temperature where it's not allowed. I think much more important, however, is making sure you have the appropriate equipment, which is often true. Me as a surgeon, when I'm in the OR, I need to make sure I have the appropriate equipment to do the surgery well. And when athletes are going to be playing outdoors, they need appropriate equipment. So you need to layer enough clothing for you to maintain an appropriate core body temperature. So that means layers of, long underwear and base layers, both in the legs and arms. It means a winter cap for your ears to maintain proper temperature, because in the coldest temperatures you can get frostbite. Gloves, playing with gloves if that's possible. So if one is saying I can't play with gloves and I'll be playing with my bare hands, then I think you have to be careful about playing below the freezing temperature, would be my hard stop. From freezing to about 50 degrees, you have to be careful but doable, making sure you're appropriately clothed and equipped. And above 50, I don't think you have much to worry about. So that would be my guidelines. I would stratify them into 3 categories. Above 50, nothing to worry about. 32 to 50, as long as you have proper equipment. I guess if you play without gloves, if you have to. And then below 32, you have to be very careful, because then issues like frostbite do become a concern.
Very good. That's great advice. We also have another question that's related to cold weather. A player may go 5 to 10 minutes without hitting a serve during one of their long matches and long rallies. And then they're asked to serve again, where they may feel a little bit stiff. So what do you recommend players can do during the match to keep their muscles in their shoulder in particular ready to go?
That's a great question. And on one hand, you hope you're lucky and you're serving out of a break, so you can do your own warm-up perhaps, but you don't always have time after the first game of a changeover. You do, however, at our level, we don't have serve clocks, correct me if I'm wrong. So you have to incorporate your own miniature dynamic warm-up. After your opponent's service game is concluded, before you start serving, you can perform your own abbreviated dynamic warm-up before you go to the service line, would be my recommendation. But that is a great question. To a certain extent, you'll be warmed up because you still will have played and you still will have hit a number of ground strokes and maybe some volleys and overheads. But in order to simulate the service motion, I would do 5 or 10 reps of the service motion on your own, 5 or 10 tosses on your own if time allows, to make sure that you're ready. It's really the best that you can do, unfortunately. Good question.
Thank you for answering that. Somebody else wrote in that they are constantly experiencing hip pain, sorry about that, particularly every time they play tennis and not in other ways, not when they go for walks or runs. Is there anything they can do to try to prevent that?
Sure. So good question. And we do hear that a lot as we're discussing a patient's concerns and taking a history. We learn about what activities hurt, what activities don't. It's often confusing and counterintuitive why it hurts with tennis, but not with running, for example, especially if you're running on a hard surface. Both have the same kind of impact. But what makes tennis different is that it is particularly difficult on your hips. So I actually trained with somebody when I was a resident at Columbia who was an elite squash player. I think he was ranked top 10 in the country in his age bracket. And he was so interested in squash, he did some research on injury risk in squash and found that obviously hip injuries were the number 1 injury risk in squash, far above and beyond any other anatomical area. And squash is like tennis, obviously, in many different ways. But it has a ton of cutting and pivoting on a hard court, which is the common thread between squash and tennis. So both have a risk to injury of the hips and significant impact to the hips, which is probably why your member is feeling it more in tennis and not as much with running, which is just more of a static, straight ahead activity. So that's to answer the why hip pain in a tennis player. In terms of what to do about it, I think first and foremost, execute some of the strategies that we've talked about today. So a structured strengthening and stretching program off the court would be very helpful. The 2 exercise programs that I've provided to you, let me just go back to those. Will have some stretches and some strengthening exercises targeted to the hips. So this is the QR code on the strengthening, just to allow your audience to take a picture of it. And then I'll get the stretching one in a moment. So make sure you're incorporating a stretching and strengthening program off the court. A lot of people feel that it's all about stretching, particularly if they feel tight. But what we should realize is that even in a less flexible patient, strengthening is equally important in mitigating injury risk. And then finally, making sure you're executing that dynamic warm-up before you play. I will say that if your hip pain continues despite these simple interventions and becomes more than just mild discomfort, then I would actually have an evaluation by a sports medicine physician or hip specialist, because we want to make sure there aren't structural abnormalities that are contributing. There are certain conditions that can create hip pain in athletes that we haven't really touched on today, but arthritis would be one of them that can rear their head that you may not have been aware of. And then there are others in the absence of arthritis, like a tear of the labrum in the hip, which is similar to the meniscus of the knee. And those things should be evaluated if the hip pain continues and starts to interfere with your ability to play.
Oh, that's great. And I think going off of that too, there's a question related to when is it time to go see a specialist? This question in particular says, I experience tennis elbow frequently and I have for years. Would you recommend that I see an orthopedic surgeon at this point? Got it.
Great question. So there's maybe 2 bundled questions there. One is in general, when should I see a physician? So if we're talking about a typical atraumatic overuse injury in an athlete, like the most of what we commonly see, it'll entail some of the things we've talked about. So what I mentioned to the previous patient with hip pain, consider some of these pearls with a structured strength and conditioning and stretching program, dynamic warm-up, making sure your diet and hydration is optimal. Those things need to be in place first, see how your body responds. Next, and of course, address the equipment concerns that we've talked about, grip and racket strings. Next, You can try some simple remedies. First, the elephant in the room is appropriate rest. So I usually talk to my youngest athletes about 2-week chunks of rest because it's really hard to engage enthusiastic athletes in more rest than that. But trying 2 weeks of rest from your current program to see if your body will respond and recover. You want to perhaps consider introducing an anti-inflammatory medicine like Aleve or Advil if you're allowed to take those medicines. Icing an injured body part. We haven't really talked about that a whole lot, but icing after exertion and when in pain can be helpful. And even some heat at night on the muscles adjacent to the injured joint can also be helpful. If you try all of those things and nothing works, then what I often recommend is you can actually visit a physical therapist on your own first before seeing a doctor. This is called direct access, and not all therapists can see you without a doctor's prescription, but many can. If they can see you for about 6 to 8 sessions and do a little bit of diagnostic work on their own and some empiric treatments on their own and get you better. Now, if you don't improve and your pain is moderate or severe, or your pain is interfering with your ability to play, and you've introduced some of these interventions and they have not worked, then I would come see a doctor for your problem. Tennis elbow is a tough one now, on to the second part of the question, because tennis elbow lasts a very long time. If you read about tennis elbow online, some articles will even talk about a year or more of pain. Now, we don't often see it last that long, but we sometimes see it last 6 months or more. And for that reason, it can be incredibly frustrating. So that's just a frustrating part of the condition. But if you see one of us, we can give you some other pearls and tricks to treat tennis elbow. And the good news about it, if you read the latest published literature on tennis elbow, if you follow it out to a year, if patients are able to endure it for that long, 90% of people will get better on their own, almost regardless of what they try and do. So it's what we call a self-limited condition for most people. It will get better if given enough time. But you can certainly see us at any time if you want additional guidance.
Very good. I know that's a very common ailment people deal with that we work with all the time. Okay, last question now. Should players proactively prevent ankle injuries by wearing ankle supports or braces? And this came from a player who has damaged their ankle in the past.
Okay. So first, let me talk about in general. So in general, in the absence of previous injury or history, should you wear ankle braces? And I would say the answer is no. There are many things you can do to prevent ankle injury. So again, strengthening program will do that. There's specific types of exercise for the ankle called proprioception, which is a term that refers to knowing where your body is positioned in space. So if you've done work with balance boards, for example, that's an example of a proprioceptive exercise. So doing ankle stabilization exercises, including strengthening of the muscles that cross the ankle, like the calf and the peroneal muscles, can help to prevent ankle sprains and similar injuries. The problem with ankle braces and taping is that they are meant to substitute for your structures. So there really isn't a role preemptively. Now, the conversations and the other truth of that is that if you start wearing those, you start to depend on them, and perhaps your muscles aren't doing as much work and might atrophy to a certain extent, and it might make you more vulnerable if you ever were to play without them. So you're kind of committed to it for the indefinite future, which we don't love. There are some people who wear protective braces preemptively, and those are athletes playing at the collegiate or professional level who simply cannot afford an injury that is going to set them out a certain amount of time. So they do wear preventative braces and taping, but we don't recommend it. What about the athlete who has a history of prior injury? So first of all, the proprioceptive exercises and the strengthening program is even more important for that athlete, but that is where we start to think about taping and bracing. So it would be fine for somebody who has a history of recurrent sprains to wear braces or to be taped by a trainer. We don't love it, but it becomes sort of a tool of necessity because every time you sprain and heal a ligament, it heals with a little bit more laxity. So people with previous ankle sprains can have a little bit more of a loose ankle, more vulnerable to sprain. The truth, though, about braces and taping is even when they're on, they don't do a whole lot. So it tends to be more of a psychological support. We know that when you have your ankle taped, even by an experienced trainer, within 10 or 15 minutes, the ankle loosens, the ankle tape loosens, and it's no longer providing the stability it was meant to provide. And braces are similar. Even the best brace from Breg or Donjoy only does a certain amount to stabilize the ankle. You may also have noticed that a lot of professional tennis players are now wearing high tops. So that's a sort of a shift in the market. Coco Gauff is one who has her own shoe on the market, which is a high top, and she's not the only one. So similar to other sports like volleyball, some tennis players are moving towards high top shoes because of the ankle sprain risk, because you're cutting and pivoting on a hard court and ankle sprains are common. But it's sort of pick your poison a little bit. If you look at basketball players that are similarly cutting and pivoting on a hard court, they went to high tops and now they're actually moving back to low tops. So I think the landscape of ankle preventative devices, whether it's taping, bracing, or high tops, changes, but nothing substitutes for a strengthening and conditioning program.
That's great advice. And those are all of our questions. So I don't know if you wanted to wrap up, but we appreciate your time so much. I've learned so much. I know the audience has too. So thank you for your time. We appreciate it.
Anytime. Thank you so much for the invitation. And I'm hopeful that some of my partners will be able to participate and kind of give you their insights about other ways that your members can stay injury-free. And I'm wishing everyone a successful winter season.
Thank you so much. And thank you everybody who was on today. We did record this and we'll be sending it out. So you can watch it as many times as your heart desires to take in all the information. So thank you again, Dr. Kowalski. We appreciate your time.
Anytime. Take care, everybody. Bye-bye.
Thank you.